Hi, this is Bob Fitrakis. You're listening to WGRN 94.1, the other side of the news.
Death and hatred to mankind, poisoning their brainwashed minds. Oh, Lord, yeah.
We're privileged today to have Lynn Tramonte with us, the director of the Ohio Immigrant Alliance. Lynn, what can you tell us about your group?
Sure. We've been around since 2007 and under different names, and we're just a group of allies and immigrants, citizens and non-citizens who think that Ohio is made stronger when we embrace the immigrants and refugees who live among us.
Tell me a little about your background. You've been involved, you worked out of the Capitol in Washington.
Yeah, I worked in Washington, D.C. for 10 years at different advocacy organizations and also with the INS as a consultant back in the late 90s. We were trying to update the immigration laws because they don't work for the vast majority of families and businesses. It's been politicized, unfortunately, and immigration reform has not moved all the way through Congress. But it's definitely needed, and I'm going to renew the call for immigration reform with the next president.
All right. Here's a question. Being in the U.S. without proper documentation, is that a crime?
No.
Or is it a civil suit? Or which is it? I've
Right.
heard commentators claim it's both.
No, they're wrong. It's not a crime to be in the U.S. without a valid visa. It's considered a civil violation. There are many civil violations in the books, federal, state, and local, that we all commit every day. And usually the remedy is paying a fine, and then you get cleared of that status. The problem is Congress hasn't created a way for somebody to pay the fine and get cleared of the status, and that's what we're dealing with.
Okay. Many people argue that your ability, it seems to be, you have a great talent of getting information out of jails and prisons. Essentially, how do you do that? I mean, these are in many cases authoritarian institutions. How are you able to bring all of these abuses to light?
I'm glad you pointed that out because I think it's really brave for somebody who has no power, who's locked in a cage, to use their voice and communicate what's happening to the rest of us on the outside. And so I absolutely admire all of the detainees and inmates who've been speaking up during the COVID crisis to let the rest of us know on the outside what's happening on the inside. And I can tell you, everything I have heard from a detainee has been true. They have told me in advance, so there's 10 sick people in our jail. This CO did that. They called the ambulance, but the ambulance, and then the jail canceled the ambulance. And I've heard these things as they happened, and then they've been validated and proven by records with the court or 911. So we have to believe these people because their lives are on the line inside. They're sitting there thinking that they've been left to die of COVID.
And again, the numbers are staggering, not only those being detained by ICE, but those in our domestic jails and particularly our federal and state prisons. What's your group's position on particularly nonviolent people that have served most of their sentences? I mean, these are like death camps.
It's a death camp. I mean, it's not like the governor and Dr. Acton didn't know that this was going to be a problem. There were thousands of doctors who were talking about what happened in Iran and China and other countries in their prison systems as COVID went through it. And like you said, it became a death sentence for people who were not ordered to die by a court of law. But DeWine, at first he wouldn't talk about it. Then he ordered judges to review cases for just a handful of people. I mean, Ohio has a an incarceration addiction as it stands. We have 10,000 more people in our jails than we have the capacity for. So ACLU and others are pointing out that we have to at least reduce by 10, but it would be better to reduce by 20,000. And like you said, there's people who are, they've completed 90% of their sentences. People with underlying disease or chronic illnesses that make them vulnerable to dying of COVID. We should have started with those people and released them just a little bit early.
Well, this brings us to the case of Oscar Lopez Acosta, who was 42 years old, from Dayton, father of 3, including a young daughter, a Honduran native, who had been deported before, but obviously returned to be with his wife and kids. What happened in the case of Mr. Acosta?
Mr. Acosta was actually assaulted in the Morrow County Jail earlier this year.
So he was in detention in Morrow County.
Thank you. I'm sorry, I should explain that. Yes, he was put in civil detention because, like you said, being here without papers is a civil violation. But in Ohio, civil detention is county jail. It's the same thing. You're in the same place, you get the same food, you have the same restrictions on your liberty. So Oscar was in immigration jail for 18 months. Earlier this year, he was assaulted in the Morrow County Jail and did not receive enough appropriate medical treatment. Later
Do you know who assaulted him?
I don't know. I don't know, and I'm not. I don't think I'd be at liberty to say if I did. But it's a population. It's a mixed population in that.
And by
jail.
that mix, you mean
county inmates and then ICE detainees.
Oh, okay. So
yeah,
ICE facility. So they're not completely segregated?
No, absolutely not. And we should get back to the Morrow County Jail because it's an interesting situation. But for Oscar, so COVID entered Morrow County Jail most likely through somebody who was transferred in from another facility and not quarantined or isolated, or from a guard. So Oscar contracted COVID in the jail, but he wasn't aware of his positive diagnosis at the time. In fact, I guess he was tested negative. He was released a couple days after ICE first admitted that there were positive detainees. He went home to Dayton, hung out with his family, and a week later or 10 days later, he died. He told his wife, I'm not going to make it. And he left, behind just family struggling to make ends meet, family grief-stricken, family trying to figure out how do they handle just the logistics of his death, his body. How did they raise the money to pay for cremation? How did they keep, paying rent? And then sadly, several of them got sick as well. It's a real human tragedy. And, I just can't, it just makes me feel so sad.
Our reporter here at the Columbus Free Press, freepress.org, columbusfreepress.com, John Lasker has been covering this story. He believes it's safe to say this is the second that Oscar Lopez Acosta can be regarded as the second undocumented immigrant to die from the virus while in ICE custody. ICE takes a different position. What's your position?
Let me think. So Oscar was in a COVID hotspot jail for several months and then went home to his family and died. So I don't really think there's a debate there. Of course, the government's not going to add another death to their tally. But the way they've treated immigrants in jail, even children have been dying from preventable illnesses. So, we know that they don't provide any sort of any care that would preserve people's lives, and they don't care about people's lives.
Okay, so Mr. Lopez Acosta had been in custody for, did you say 18 months?
Correct.
And all of this, or most of it in the Morrow County Correctional Facility, or?
I'm not sure how much he spent there versus other places. I think he was there for at least 6 months, but I think he was in some other places too.
Now, this is one of what, 4 jails that are contracted out to ICE in Ohio?
That's correct. There are 4 county jails that have county inmates who are accused of crimes and federal civil detainees. And Morrow County is a small county. It's only 35,000 people. So they wouldn't even have a jail if there wasn't for the immigration contract. They don't have enough population and enough crime to justify having their own jail.
Okay, and the jail's run by the Morrow County Sheriff, John Hinton.
Yes.
Roughly 130 beds, 60 to 70 inmates as we went to press. So why did they suddenly release Mr. Acosta? Was there a reason?
Yeah, you know what? I'm sorry. I don't know the answer to that. I wasn't working on his case, so I don't know. At that time, it was around the time that the ACLU started filing a lawsuit, but I don't know the exact cause.
So he had an immigration attorney helping him. And of course, I think you mentioned this or alluded to it. He had cellmates that were testing positive for COVID-19. Was it a hot spot? Was the Morrow County Jail a COVID hotspot?
Yes, it is a COVID hotspot. It's 100% infected. The officials have not admitted that, but when they stop isolating sick people and keep all of the population in one place, that's because they're assuming that everybody's sick. So, it's this little jail in a small county in Ohio, and it's just teeming with COVID, and it needs to be shut down. The jail itself has mismanaged this crisis so poorly that there's no fixing it. It needs to be closed.
So he was not tested while in custody in the Morrow County Jail, correct?
I think he actually was tested and he tested negative.
Let's see. He was, was it the Dayton County coroner that confirmed that he had been exposed to the virus?
Oh gosh, I'm so sorry. I don't know.
Yeah, I'm working
off
Free Press
yeah.
notes. We're saying he wasn't tested while in, fell ill, returned home, died a week later on Mother's Day, and that his fact he had the virus was confirmed by the Dayton County Coroner's Office.
Okay, well, I trust.
But the assumption is virtually, and I don't know if you can verify this, but that virtually everyone in the jail seemed to be exposed to the virus.
Oh, absolutely, because the way the jail is set up is it's not individual cells. Everybody lives in one big room, and the beds were very close together. There was no soap available unless you paid for it until very recently, and they were not isolating people that they brought in from the outside.
One more time with that is that you had to buy your own soap during the pandemic.
Yeah, after a few weeks of us complaining, they finally made some soap available, but it kept running out. But yes, weeks into the pandemic, you could not get soap unless you purchased it yourself.
So again, clearly, was there any warning? I know the ACLU's been suing in other organizations, but clearly somebody had to anticipate this was going to be a problem if you housed everyone in the same area.
Yes.
I mean, they had warning from your perspective?
Of course. In February of 2020, Freedom for Immigrants filed a complaint with the Department of Homeland Security, citing several sanitary and hygiene problems in the jail, such as the lack of soap, the lack of clean clothing and bed linens to be provided. And the Ohio Department of Rehabilitation and Corrections in 2018 issued their inspection report had some of the same complaints. Morrow County, up until 2019, didn't even have an infection control program in place, which is a requirement in Ohio law. In 2019, they put a program in place, but in 2020, they didn't even follow it. And we will have some more information coming out soon about their failure to follow their own infectious control plan.
Well, the Free Press reporter, again, John Lasker, says the jail was filthy. There was no way to isolate inmates if they contacted the virus. As you point out, they were just in this general population holding area, and that many were complaining about being sick, and essentially nothing was being done for them. Is that correct?
That's right. They have nurses who come to the facility during the day, during the week, but they were refusing to give people even Tylenol unless their fever spiked to 104. At the night, at
So if they're at
evening,
103, you want to conserve the Tylenol? Is that? I mean, that just,
you know what they told them?
absurd.
They said, we want to test your body to see how it responds, like they're lab rats.
But it's just like the Tuskegee,
Exactly.
experiment.
Experiments on humans, and they're immigrants, so they probably thought they wouldn't speak up, but they did. There's not been a doctor to see any of the sick patients, despite what the health department seems to think. And even access to emergency care has been a huge problem. People have been struggling to breathe, and the guards refuse to call the ambulance.
The Morrill County Health District, did they have any role in this?
Well, no, they didn't. That's the problem. We went to their meeting last May, in May, and we told them about what was going on in the jail. They had no idea. They tried to pretend that they did. At first, they were focused on telling us that it wasn't their responsibility. Then we sat through their whole meeting where they were talking about how they have to help all the businesses and local entities in Morrow County deal with COVID. And, it became obvious, which we had already knew, that they do have a responsibility to help the jail be a safe place. So then they started telling us that our facts are wrong. But our facts are not made up. Like I said, not only do they come from folks that are inside the jail who so far have everything they've said have been validated. Our facts came from a judicial order from the actual judge in the ACLU lawsuit, a U.S. District Court judge, Trump appointee, who was reiterating the serious lack of medical care, and she had very strong words for the way people were being treated.
Now, some have said that City Council President Pro Tem Elizabeth Brown has been concerned with this, even though it's a couple counties away. What can you tell us about that?
Right. I mean, what's crazy about the Morrow County Jail is that most of the people in it are not from Morrow County. They're from Cincinnati, Dayton, Mansfield, Cleveland, Columbus, because they're immigration detainees. So Morrow County took on this responsibility to take care of, or, to take custody of people from other parts of Ohio. So the rest of us have a stake in what goes on at Morrow County. So that's why Council President Liz Brown got involved, because she was sticking up for her constituents, Columbus residents who were detained in Morrow County for immigration.
Now, what are the other counties that have these ICE detainment centers?
Butler County in Southwest Ohio, Seneca in the Northwest, and Geauga County in the Cleveland region.
Okay, and this is well established. And I assume the counties do it to make money for revenue.
Yep, that's absolutely right. They get, Morrow County gets about $68 a night for every immigration detainee that it has.
Okay, and there's a protest scheduled, is there not?
Yes, there was a protest yesterday. And then on the 6th, so that protest was immigration focused. It was in downtown Columbus. And then on June 6th, there's a massive statewide protest we will all be convening in Columbus, and it will be people who are advocating for state prisoners, federal prisoners, immigration detainees, and county inmates to say, let's get some common sense here. We should release the people that we can release from jail in Ohio so that they can be safe, and that we slow down this spread of COVID in the jails.
Now, since you're taking on COVID, will there be proper social distancing at your rally?
Absolutely. Masks, social distancing. We will be in cars for the most part. But, you know, we still need to make our voices heard because we don't think our leadership is doing the right thing here.
And that leadership would be the state leadership?
The state leadership, the governor, the health department director, a director of the Ohio Department of Rehabilitation and Corrections, and even, and then, of course, the county leadership as well.
This is The Other Side of the News, streaming to you from the Indy-Media studios of the Free Press Network on YouTube, but also available online at WGRN.org. Plus, listen to us on Columbus, Ohio's 2 volunteer-run low-power FM radio stations, Friday at 5:30 p.m. on 94.1 FM, The Green Renaissance, and rebroadcasted Mondays at 4:30 p.m. on WCRS, the community radio station, both 92.7 and 98.3 FM.
Can you go into what are some of the other things the Ohio Immigrant Alliance does? I mean, we have you here with fighting the free people from a COVID hotspot. What else do you do?
Well, in the past few years, most of our work has been trying to prevent the deportation of Ohioans who've lived here for decades and have children here or families here. There's a group of people that are both deportable and allowed to stay under the law. It kind of goes, they have 2 paths, and the choice is a political choice. So with Obama, after lots of advocacy, people were ultimately allowed to stay and build their lives here. And then with Trump, it was just a matter of, okay, you need to go tomorrow, you need to go tomorrow, you need to go tomorrow, just massive family separation. So we've been trying to slow it down and prevent it as much as possible, because the trauma that a deportation has on a family, it cannot be overstated. It's devastating, and it doesn't have to happen. It's a civil violation.
Does your group look into any of the complaints? I know a while back there were many workers, undocumented, in Franklin County that were complaining that law enforcement and other officials were stealing their money. I mean, we're deporting them, we're in fact ripping them off.
Absolutely.
Are you familiar with those problems? And do you
I am.
That area?
I am. And the exploitation of workers, which is a huge problem in Ohio, in our poultry plants and on some farms. It's sort of like a profit situation where we want to work people to the bone for low wages and work them so hard that they can't complain, because if they complain, they'll be deported. And it's just absolutely disgusting that we let that go on here in Ohio.
Does Ohio have any of the problems with meat packing that some of the other states have clearly come up with?
We do. We do. I mean, it's actually been major national news from case farms. There have been several, deaths and loss of limbs because of OSHA violations. On Ohio egg farms, there was a trafficking scandal, human trafficking, where employers were, basically enslaving young people from Guatemala. Ohio, just like we somehow distinguish ourselves with serial killers, we have a lot of serial killers from Ohio. We also have a lot of really bad, abusive employers. And I'm not saying that everybody is like that, but we certainly have a lot, and there's very little enforcement that's pro-worker. It's usually enforcement against the worker.
Of course, you could argue some of these new COVID hotspots, some run by ICE, look like a place where people are being killed in a serial fashion.
Absolutely. I mean, it's not hyperbolic at all. Like, it's a deadly virus, and
It's all predictable. I mean,
it's predictable and preventable. And it's important to know too that the people that are in jail, in immigration jail, they're still, their cases are still ongoing. So why can't they just be out and be free while their cases are ongoing? Why do they have to be in jail? It's a strategy the government uses to try to get them to give up their case, to demoralize them. So they say, forget it. I'm not going to keep fighting. I'll accept deportation. It's about power. And it's really sad that our government uses its power against, fathers, husbands, and employees.
Any thoughts on the sanctuary movement? We've got a couple people here in Columbus. Is that of any value in fighting against the deportations?
Oh, absolutely. I mean, I think that the people that are in sanctuary are heroes to us and those of us fighting. We know it's not an easy life to live, within four walls for 4 years. And we really need political change and leadership in Washington so that they can get out and get free, and so that we can get Congress to do its job and pass immigration reform.
And what about the president's threats to punish those that are sanctuary cities or who run sanctuaries? How should we treat that?
It's just red meat for his base. It's been stopped in the court. And it's also, the idea of sending law enforcement into certain cities based on politics, it's so Orwellian, but it's just one of so many examples that you almost can't even count them all.
Okay, well, it looks like we have a minute or so left. What do you want to tell the listeners on WGRN and the other side of the news? How can they get involved?
Yeah, we're a volunteer organization. You can join us on Facebook at Ohio Immigrant Alliance. And once you request membership in the group, you can get engaged. You can learn about, events to show up to, call actions to call certain policymakers, online actions that you can take. And it really matters. We're building a network of people who are both foreign-born and born in Ohio and U.S.-born, who all think that we're stronger together, and think that Ohio's future is based in part on embracing diversity and new strengths and new ideas. So we have plenty of work to do, and we want you to be part of it.
All right. Thank you, Lynn Tramonte with the Ohio Immigrant Alliance. Thanks for being part of the other side of the news.
Happy to be. Thank you.
Thank you.
And hatred to mankind, poisoning their brainwashed minds. Oh, Lord, yeah.